If you are over 60 and your memory suddenly does not feel as sharp as it once did, there is something I want you to check before you simply blame your age. Your medicine cabinet? Maybe you forget a familiar name in the middle of a conversation. Maybe you walk into a room and cannot remember why you went there. Maybe you repeat a question without realizing you already asked it. And immediately, one frightening thought appears. Is this dementia? That question deserves to be taken seriously, but memory changes do not always have one explanation. Sometimes a medication that is helping your allergy, bladder, anxiety, pain, or sleep can also make you more drowsy, confused, or mentally slow. And after 60, that matters even more. As we age, the body can process certain medicines differently. The kidneys and liver may clear some drugs more slowly. The brain may also become more sensitive to medications that cause sedation or interfere with chemicals involved in attention and memory. And here's the part people often miss. The medication may have been working perfectly for years. So when brain fog begins, nobody thinks to question it. They simply say, "You're getting older." Today, I'm going to walk you through 7 common types of medication that deserve a closer look when memory or mental clarity changes after 60. This does not mean these medicines are bad, and it definitely does not mean you should stop any prescription after watching this video. Some medications on this list can cause serious withdrawal or other problems if they are stopped suddenly. The goal is much simpler. Know what you take, know what effects to watch for, and know what questions to ask your doctor or pharmacist. And stay until the end, because the greatest risk may not come from one medication at all. It can come from several ordinary medications quietly affecting your brain at the same time. Let's begin with number 7. Number 7, older antihistamines. One of the best known examples is diphenhydramine. Many people take it for allergies, but it can also appear in nighttime medicines and products labeled with words such as PM. Another older antihistamine found in some sleep products is doxylamine. These medications are easy to underestimate because many can be purchased without a prescription, but over-the-counter does not mean harmless. Older antihistamines can cause significant drowsiness, and some also have what doctors call anticholinergic effects. That word is important. Acetylcholine is a chemical messenger your nervous system uses for several important functions, including attention, learning, and memory. An anticholinergic medication interferes with that signaling. Imagine your brain trying to record a conversation while someone slowly lowers the volume. The information may still be there, but it becomes harder to register clearly. And if your attention is impaired, when something happens, remembering it later becomes much harder. That is why someone may take a nighttime antihistamine, sleep for several hours, and still wake feeling mentally foggy. They may struggle to remember whether they took their morning pills. They lose their train of thought. They cannot find something they put away the night before. Then they assume, my memory is getting worse. But the timing matters. Did the fog become more noticeable after the sleep medicine started? Does it improve on days when the medicine is not used? Is the same ingredient hiding in more than one product? That last question is particularly important. Someone may take one medication for allergies and another nighttime product for sleep without realizing both contain similar sedating ingredients. So here's a simple step. Turn the package around. Do not read only the brand name. Look at the active ingredients. If you regularly use diphenhydramine, doxylamine, or another sedating antihistamine, and you have noticed daytime sleepiness, confusion, or memory problems, ask your doctor or pharmacist whether it is still the best choice for you. Do not automatically stop something you need. Just stop assuming that a medicine cannot affect your brain because you bought it without a prescription. Now, number 6 acts on a very similar brain pathway, but people may take it every single day. Number 6, oxybutynin and certain other bladder medications. Overactive bladder can completely change someone's life. You avoid long trips. You always look for the nearest restroom. You wake several times during the night. You may even stop visiting people because you are afraid of having an accident. So when oxybutynin controls those symptoms, the improvement can be enormous. But oxybutynin also has anticholinergic effects. There is that word again. It helps relax the bladder, but in some people it can also contribute to effects such as sleepiness or confusion. Imagine a 72-year-old woman starts taking it. Her bladder improves. A month later, her daughter notices she seems more forgetful. Nothing dramatic happens. She simply repeats herself a little more. She needs longer to remember a word. She misplaces her keys. Nobody thinks about the bladder medicine because it is doing exactly what it was prescribed to do. That is why one of the most useful questions in medicine is, what changed before this symptom appeared? Did a medication start? Did the dose increase? Was another medication added? Did the person begin taking an over-the-counter sleep aid? That timeline does not prove that the medication caused the problem, but it gives your healthcare professional an important clue. And there is another issue. Many people over 60 see several different doctors. One doctor treats the bladder, another treats arthritis, another manages blood pressure, another treats anxiety. Each doctor may make a reasonable decision, but if nobody reviews the complete list together, overlapping side effects can easily be missed. So if you take oxybutynin or another bladder medication and your thinking has changed, ask, could this medicine be contributing to my confusion or memory problems? Do I still need the same dose? Are there other treatments that may be appropriate for me? Those are questions worth asking. Now, number 5 comes with an especially important warning. Do not suddenly stop this medication if you have been taking it regularly. Number 5, benzodiazepines. Examples include alprazolam, lorazepam, diazepam, and clonazepam. These medications can be used for conditions such as anxiety, panic, insomnia, or seizures. And when severe anxiety is controlling someone's life, the relief can feel dramatic. The racing thoughts slow, the panic settles, the body relaxes, but benzodiazepines also slow activity in the central nervous system, and that can affect much more than anxiety. They can make some people sleepy, slow their reactions, reduce concentration, and interfere with the ability to remember new information. Think of your brain like a car. Anxiety can feel as though the engine is racing dangerously fast. A benzodiazepine can help slow it down, but if the calming effect becomes too strong, the entire car starts moving slowly. Reaction time decreases, attention becomes less sharp, and the brain may not record new information as clearly. Some people describe feeling as though they are living behind a layer of fog. They can talk, they can move, they are awake, but their mind does not feel fully present. And after 60, this effect can be amplified by other problems. Poor sleep, pain, dehydration, alcohol, or other sedating medications. There is also another reason benzodiazepines require caution. The body can develop physical dependence. That means suddenly stopping them after regular use can cause withdrawal, and withdrawal can sometimes be serious. So this is absolutely not a medication you should throw away after watching a video. Instead, ask, do I still need this medicine? Is this the lowest effective dose? Could it be affecting my alertness or memory? And if we ever reduce it, what is the safest way to taper? That conversation should happen with the professional managing your treatment. Now we reach number 4. This is one many people start taking because they are desperate for something we all need. Sleep. Number 4. Prescription sleep medicines such as zolpidem. Insomnia can be miserable. You go to bed exhausted. Then your brain suddenly becomes wide awake. You turn over, look at the clock, try another pillow, think about tomorrow, look at the clock again. Eventually, medication may seem like the only way to get through the night. Zolpidem, often known by the brand name Ambien, is one medicine used to treat insomnia. It can help people fall asleep, but because it acts on the brain, it can also cause next morning impairment in some people. Memory effects can occur as well, and older adults may be especially sensitive to sedative medications. Here's what that can look like. Someone takes a sleep pill, then they have a conversation with their spouse before going to bed. The following morning, the spouse says, "Remember what we talked about?" And the person says, "No, we never talked about that." Except they did. Sometimes the problem is not that an old memory disappeared. It is that the brain did not form the new memory normally while the medication was active. Then there is the morning after effect. You may technically be awake while some sedative effect remains. Your thinking can feel slower, your judgment may be impaired, your balance may not be normal. And if another sedating medication is added, the effect may become stronger. Imagine someone takes a sleep medicine at night. They also take medication for anxiety. Then they take an opioid for back pain. Now, several drugs are pushing the central nervous system in the same direction. That combination deserves careful medical supervision. So if you use a prescription sleep medicine and regularly wake feeling confused, excessively groggy, or unable to remember events around bedtime, tell your prescriber. And instead of simply asking for a stronger dose when sleep gets worse, Ask another question. Why am I not sleeping? Pain can disrupt sleep. So can sleep apnea, anxiety, depression, restless legs, alcohol, caffeine, certain medications, and irregular sleep habits. Sometimes treating the reason behind insomnia is more useful than continuously increasing sedation. Now, number 3 surprises many people because it may have originally been developed for depression, yet today it can be prescribed for several completely different problems. Number 3, amitriptyline and other strongly anticholinergic tricyclic antidepressants. Amitriptyline is an older antidepressant, but it may also be used in certain cases for nerve pain, migraine prevention, or other conditions, and it has both sedating and anticholinergic effects. By now, you know what that means. We are interfering again with acetylcholine, a chemical involved in attention and memory. This is where the list begins to connect. The nighttime antihistamine may have an anticholinergic effect. The bladder medicine may have one. Amitriptyline may have one too. One medication might create a manageable amount of fog, but what happens when several are taken together? We will come back to that. First, imagine someone was prescribed a low dose of amitriptyline 5 years ago for nerve pain. It helped, so they continued taking it. Year after year, because there was no obvious crisis, nobody reconsidered the prescription. Then, at age 74, the person starts becoming slower mentally. The family notices. But the medication is so familiar that nobody thinks of it as something that could still matter. This is an important point. A medication does not need to be new to deserve review. Your body changes over time. Your kidney function can change, your liver function can change, your weight may change, your other medications change, and the original reason you started the drug may no longer be exactly the same. That is why you should occasionally be able to answer a basic question about every medicine you take. Why am I taking this? If you cannot answer that question, put the medication on your review list. You can also ask, is it still helping? Could it be contributing to my sleepiness, dizziness, confusion, or memory concerns? The goal is not to remove medicines, simply to have fewer pills. The goal is to make sure every medication still provides more benefit than burden. Now, number 2 is another medication people rarely associate with memory because the name sounds as though it affects only one part of the body. Number 2, muscle relaxants such as cyclobenzaprine. If your back suddenly locks up or you develop a painful muscle spasm, relief can be incredibly important. Cyclobenzaprine can be used for muscle spasms, generally as part of a broader treatment plan, but it can also cause drowsiness, dizziness, and confusion, and it has anticholinergic properties as well. The phrase muscle relaxant makes it sound targeted, almost like the medicine travels straight to the tight muscle and ignores everything else. But medications do not stay inside the body part named on the label. If they affect the central nervous system, the brain may also feel the effect. This becomes especially important at night. Imagine an older adult takes a muscle relaxant for back pain. At 2 o'clock in the morning, they get out of bed to use the bathroom. They are groggy, their balance is worse, the room is dark, they feel confused for a moment. Now, memory is not the only concern. Falls become part of the picture too. And there is one phrase families often use that should make you pay attention. He isn't acting like himself. If an older person becomes noticeably confused over a very short period, do not simply assume it is aging. Dementia usually develops gradually. Sudden confusion may be something called delirium. And delirium can be triggered by many things, including infection, dehydration, illness, metabolic problems, hospitalization, and medications. So, if someone was mentally normal 2 days ago and now cannot follow a conversation, seems unusually sleepy, is agitated, or does not know where they are, that deserves prompt medical attention. Ask what changed. Did they get sick? Did they start a new medication? Was a dose increased? Did they leave the hospital with several new prescriptions? Sometimes the timeline tells you where to start looking. Now we reach number 1. This medication class can be extremely important for people living with severe pain. So the goal is not to frighten anyone away from necessary pain treatment, but it deserves respect because it can strongly affect the central nervous system. Number 1, opioid pain medications. Examples include medications containing oxycodone, hydrocodone, morphine, and others. Opioids change how the brain and body perceive pain. For someone recovering from surgery, dealing with cancer pain, or experiencing severe chronic pain, that relief may be essential. But opioids can also cause drowsiness, dizziness, slowed reactions, and confusion. Now compare two people. The first is 40 years old, they have surgery, they take an opioid for a short period, they take no other sedating medication. Now imagine someone who is 78. They take an opioid for chronic pain. At night, they use a sleep medication. Sometimes they take an older antihistamine. They also have a benzodiazepine for anxiety. The same opioid is entering a completely different environment. That second person already has several medications slowing the brain. One adds sedation, another adds more sedation, another may contribute anticholinergic effects, and eventually the family notices something frightening. Mom sleeps through most of the afternoon. She repeats herself. She seems less engaged. She occasionally becomes confused. They immediately think her dementia is getting worse. That may still need to be evaluated. But the medication combination also deserves attention. There is another serious point here. Combining opioids with benzodiazepines or other powerful central nervous system depressants can dangerously increase sedation and suppress breathing. That is much more serious than ordinary brain fog. So your doctors should know about every sedating medication you take. And opioids are another class that should not necessarily be stopped abruptly after long-term use. If physical dependence has developed, withdrawal can occur. Again, the solution is not to throw medications away. The solution is to ask better questions. Is this still the lowest effective dose? Is it actually improving my ability to function? Could another medication be increasing the sedation? Do I still need everything on my list? And now we reach what may be the most important lesson in this entire video. Because the biggest problem may not be any single medication we discussed. It may be the combination. This is sometimes called polypharmacy, meaning the use of multiple medications. Imagine this situation. A person takes an older antihistamine occasionally for allergies. They take oxybutynin for their bladder, Amitriptyline for nerve pain, a sleep medication at night, a benzodiazepine for anxiety, and after injuring their back, an opioid or muscle relaxant is added. To that person, every pill treats something different: allergies, bladder, pain, sleep, anxiety, muscle spasms. But the brain does not organize medications by the condition printed on the bottle. It experiences their combined effects. Several may increase sedation, several may add anticholinergic burden, some may intensify one another. This is why asking, "Is this medication safe?" is not always enough. Ask instead, "Is this medication appropriate for me at my age, at this dose, together with everything else I take?" That is a much better question. And your medication list should include more than prescriptions. Include over-the-counter medicine, cold remedies, allergy medicine, sleep aids, pain relievers, vitamins, herbal products, supplements, everything, because your doctor or pharmacist cannot identify an interaction with something they do not know you are taking. So here is what I want you to do. Make one complete medication list. Write the name, write the dose if you know it, write why you take it, write when you take it, and beside each medication, write approximately when you started it. Then bring that list to your doctor or pharmacist and say, "I've noticed changes in my memory or mental clarity. Could we review whether any of these medications or their combination might be contributing?" That is not self-diagnosis. That is responsible medication management. Because memory problems have many possible causes. Poor sleep can affect memory. Depression can affect concentration. Hearing loss can make someone appear forgetful because they never clearly heard the information. Vitamin deficiencies, thyroid problems, infections, dehydration, stroke, neurological conditions, and dementia can all be involved. Medication effects are simply one part of the investigation. And remember this distinction: slowly increasing forgetfulness over months or years deserves a proper medical evaluation. But sudden confusion over hours or days should be treated differently. If an older adult suddenly becomes disoriented, extremely sleepy, agitated, hallucinating, or unable to follow a normal conversation, do not assume they suddenly developed ordinary age-related memory loss. They may need prompt medical assessment. Now let's quickly review the 7 medications. Number 7, older antihistamines such as diphenhydramine and doxylamine. Number 6, oxybutynin and certain other anticholinergic bladder medications. Number 5, benzodiazepines such as alprazolam, lorazepam, diazepam, and clonazepam. Number 4, prescription sleep medicines such as zolpidem. Number 3, strongly anticholinergic tricyclic antidepressants such as amitriptyline. Number 2, muscle relaxants such as cyclobenzaprine. And number 1, opioid pain medications. But do not leave this video thinking these 7 medicines cause dementia. That is not the message. The message is that certain medications can affect alertness, concentration, memory, or confusion in some people, particularly as we get older or when multiple medications are combined. And sometimes those effects can look frighteningly similar to worsening memory. So if your thinking has changed, ask, what changed before this started? Did I begin a new medication? Did my dose change? Am I taking more than one sedating medication? Do any of my medicines have anticholinergic effects? Do I still need everything on my list? And when was the last time somebody reviewed all of my medicines together? Do not stop an important prescription on your own. Do not change doses randomly. And do not replace medication with a supplement simply because someone calls it natural. Use what you learned today to have a better conversation with someone who knows your health history. Because there is a huge difference between being afraid of medication and understanding medication. Medication can save lives, it can reduce pain, it can restore independence, it can control serious illness. But powerful medicines deserve regular review, especially after 60. So tonight, take a look inside your medicine cabinet, read the labels, make your list. And if your memory has changed, bring that list to your next medical visit. Sometimes the answer will have nothing to do with medication, but sometimes one simple review can uncover a contributor that everyone overlooked. And that matters because not every forgotten word means dementia. Not every foggy morning means Alzheimer's disease. And not every change in mental sharpness should automatically be dismissed as, that's just what happens when you get old. Your brain deserves a better investigation than that. If you found this useful, tell me in the comments how many medications you currently take each day. And if you have ever noticed unusual brain fog after starting or changing a medicine, you can share that experience too. Your comment may help someone else realize that they should review their medications with their doctor. And in the next video, we are going to look at another set of warning signs many adults over 60 dismiss as normal aging. They can appear while walking, climbing stairs, or even simply standing up. And sometimes they are telling you something important about your circulation long before a serious problem becomes obvious. Until then, take care of your medications, take care of your memory, and never assume that losing your mental sharpness is automatically the price of getting older.